Hello, today we are going to talk about complications of sinusitis. Orbital infection is the first complication of sinusitis, most commonly seen with ethmoid sinusitis. So, most common complication is the orbital infection, and the most common orbital infection comes from the ethmoid sinuses. Number second, mucocele formation. Mucocele formation. It is expansion of sinus due to retained mucus inside frontal sinus, ethmoid sinus, and treatment is FAS. Then we have osteomyelitis of frontal bone. We may get osteomyelitis of the frontal bone. Complications of frontal sinusitis. Then we have osteomyelitis of the frontal bone, subperiosteal abscess. We have subperiosteal for frontal abscess, red tender forehead swelling, ptosis, puffy tumor, Pott's puffy tumor. It is also called as Pott's puffy tumor. Then we have maxillary osteomyelitis is more common in children. Frontal osteomyelitis is more common in adult. We have intracranial complications. These are cavernous sinus thrombosis. Most common benign tumor of sinuses is osteoma. Most common in frontal sinus. We have completed the complication of sinusitis. So remember, orbital infection, mucocele, osteomyelitis of frontal bone, maxillary osteomyelitis, intracranial and intracranial complications. These are the four complications of sinusitis. Over. Topic change. Most common benign tumor of sinus is osteoma. Most common in frontal sinus. Most common benign tumor of nasal cavity is capillary hemangioma, bleeding polyp of septum. Site of origin is Little's area. Most common malignancy of skin of external nose, basal cell carcinoma or rodent ulcer. So, rhinitis medicamentosa. Now, what is rhinitis medicamentosa? Next topic. Another topic. Rhinitis medicamentosa. Causes prolonged use of decongestant nasal drops, xylometazoline, oxymetazoline, lead to rebound congestion. So, stop these drops, start steroid nasal spray. Change of topic. Change of topic. Vidian nerve. Vidian nerve, nerve of pterygoid canal, also called as nerve. It gives autonomic nervous supply to nose. It is made of two nerves. It is made of two nerves. Vidian nerve is made of two nerves. It gives ANS supply to nose. Vidian nerve is made of two nerves, greater superficial petrosal nerve or parasympathetic. It is parasympathetic nerve. Deep petrosal nerve, it is sympathetic nerve. So it has two. If parasympathetic component gets overactive, it will lead to vasomotor rhinitis, excessive nasal discharge, or change of temperature. We can do Vidian neuronectomy. So we have changed it. We have completed this Vidian nerve topic in relation to rhinitis medicamentosa. We can do Vidian neuronectomy. Another topic, nasal cycle. Nasal cycle, it is rhythmic congestion and decongestion of two nasal cavity alternatively. Duration is 2.5 to 4 hours. Acoustic rhinomanometry, it is used to record total nasal airflow, resistance to nasal airflow. We have acoustic rhinomanometry used to record one total nasal airflow, resistance to nasal airflow. Inspiratory and expiratory air currents mainly pass through middle part of nasal cavity in a parabolic manner. Khalas.